Hello relatives, don't look twice. This is Dr. H. I'm live from Iquitos, Peru, where I am on a clown trip with my holy brother Patch Adams. On a clown trip, I am in my best tank top and my clown nose, just so that you can see a little bit of what this is going to look like over the next couple of weeks when I report on this extraordinary event. So welcome to this week's Bite, live from Iquitos for the week August 18th, 2010. So Patch and Gesundheit Institute and Bola Roja, the Peruvian Clowning Association, have been coming to Iquitos for the last 6 years to organize a grassroots approach to public health delivery. These clown trips have become an instrument of change in the city's poorest slums. They have helped to integrate the healthiest parts of the community into a network of agencies who continue to do the hands-on healing healthcare work here. We work in the poorest area of this city, which is called Belém. It's a community that lies in the Amazon floodplain. So every year during the rainy season, Belém homes are flooded out. People build rudimentary bridges, they commute in canoes and rafts, they have no access to sewage or potable water, and the rest of Iquitos dumps its waste here as well. The water, in which children, by the way, swim happily, is filled with raw sewage. All the ravages of poverty and powerlessness are here. Violence, crime, alcoholism, child prostitution, sexually transmitted diseases, teen pregnancies, drug use are all rampant. When I come down here, I conduct a mental health clinic. And this year, it was held in a one-room flophouse where for pennies, someone can lay down their mat on the floor, and for a quarter you can get an enclosed space. There's a rudimentary pharmacy that dispenses some drugs, but there are no psychiatric medications other than Valium. I'm in a huge room, and it's filled with sick and crying children. There are adults who are getting sewn up. There are infected wounds everywhere. But somehow this noisy circus is organized and it works. I sit in one corner for some bare semblance of conversational privacy. I sit there with my patient and a wonderfully sensitive interpreter whose name is Rosa. The first patient we see is Pablo. He's 17 years old and he suffers from daily episodes of spells that he describes simply as not being able to remember anything, not what his teacher is saying, or if he's playing soccer, he blanks out and doesn't remember what to do with the ball. These spells happen on a daily basis and have for over the last year. He doesn't feel them coming on. They can last from moments to a half hour, and wondered whether, because he fell and bumped his head several years ago, that maybe that's the cause of his current problem. He seemed to me a little bit withdrawn, somewhat lethargic, but he denied any sleep problems or suicidal ideation, and on neurological examination there was no gross abnormalities, and there was no family history of a seizure problem. Pablo did say that he has never told anybody about his real symptomatology. He tells them only when they ask, whether teacher or family, that he's not feeling well, and they don't pursue it any further. I asked him if there was anybody that he trusted enough to share the real truth with, and he said that he'd only told us the truth, and that was more than he'd ever told anybody else in his life. And I said that if he could just talk to one other person about what he was feeling, what he might be afraid of, and his symptoms, I was sure, would improve, but Pablo insisted that there was no one. So I told him that before I left town I was going to leave a gift for him. It was from Rosa and me. so that he could at least talk to us whenever he wanted to again. And over the next days I bought him a fluffy lion and sent it to him with a note that said he had the heart of a lion, because whenever he was hurt, he still remained strong and fearless, but that his skin was also soft and furry, so that there were a few people who could always get close to him. I thanked him for letting me get close and to be able to touch him, and it touched me too. And that I hoped that through this lion we would touch again and again. And then I saw Gloria, a woman in her early 20s, who came because she wanted me to look at her 7-year-old son Pablo, having suffered only recently from epileptic seizures. Gloria went on to say that she thought that she may have contributed to his problems because for many years she told her son that she didn't want him. She would repeatedly tell him that he reminded her of his father, who had abandoned her before Pablo was even born. Gloria then lived with another man who fathered her second child, now a 3-year-old son, and she was currently 6 months pregnant. A month ago, her second man abandoned her as well. So she supported herself by working as a waitress, and then later added that in order to feed her children, she was also working as a prostitute. There were tears rolling down Rosa's cheeks when she was translating Gloria's words. My training in psychiatry hasn't prepared me well to deal with these kinds of overwhelming social problems. I mean, just her survival needs were so intense that it's clear that no insight-oriented psychotherapy or psychiatric drugs are going to make a lot of impact here. I felt helpless. I mean, helpless in providing any meaningful support. So at the end of our 45 minutes together, the only thing I could say was that her son would always love her, and to be the best mother that she could, so that he could love her even more. And before leaving, she thanked us, and I was wondering for what. She said, as an addition, "Thank you for listening to me. Here in Berlin, just being paid attention to and knowing that you've been heard is enough." Stay well, relatives. Say thank you for everything you get. Stay connected to others. Tell each other your stories. It is in our stories that we share not only the intensity of our lives, but stay connected and help us make sense of them. Have a great week. I say this for all my relations live from Iquitos, is Dr. H. Have a great week. Mitakuye.